Good afternoon, ladies and gentlemen. Welcome to the special climate and health session, which we're doing today on day 2 of the Hub Live at Climate Week NYC. As you are aware, probably because I've said it 1,001 times, there are over 900 events taking place this week at Climate Week NYC, making it the largest climate event of its kind on the planet. And that's a 50% increase on last year. So when we say that our catchphrase is, it's time, it's certainly time right now. And I am so personally delighted that we're able to get this session together because last year we started discussions with a number of different groups, including the Wellcome Trust, who kindly support us, in the importance of climate and health as a new narrative for us to fight climate change. And we held an exploratory meeting last year, and some of our panelists were at that meeting. We held the first ever Climate and Health Day at the US Climate Action Summit, and we decided to go for it. So we created an official theme this year of health as part of those 900 events. And this is the headline event that we're having as part of our program here today. So I want to say a massive thank you for being part of that. And we've got a great panel joining us today. So I'm not going to take up any more of your time because I assure you they are much more interesting than me. So without further ado, I'm going to introduce a fantastic person who's leading in this space, Shaila Raghav, who is the Chief Climate Officer at Time. Shaila.
Thank you, Adam, and I can emphasize that it's Time working at Time magazine. I'm delighted to be with you today. I've worked on climate change for many years, and I think we've really recently seen an incredible recognition of the importance of the nexus between climate change and health. But at the same time, it's such a broad topic, right? What do you mean when we talk climate and health? Are we talking about the environmental footprint and impact of the healthcare sector on meeting our net zero goals? Are we talking about climate resilience and the impacts of climate change on vulnerable populations? Are we referring to the changes that we expect to see over time and how the healthcare industry and sector will have to adapt and respond to provide populations with the care that they need? There are so many dimensions for us to discuss, and I'm so delighted to welcome our 3 panelists who will dive into some national security, medical, and also private sector dimensions of the topic. So without further ado, may I invite our panelists. We're starting with Meredith Berger, who's the Assistant Secretary of the US Navy, who will discuss the Navy's role in climate resilience and national security. Welcome, Meredith. Thank you. Then we have Johanna Jobin, who is the Global Head of Environment and Sustainability at Takeda, who will share Takeda's efforts in building resilient healthcare systems while promoting sustainability. Welcome, Johanna. And last but certainly not least, Dr. Victor Zhao, who is the president of the National Academy of Medicine, who will highlight the growing need for climate adaptive healthcare systems, but also the importance of the public sector in demonstrating leadership on the topic. So welcome to the 3 of you, and really delighted to have your diverse perspectives contributing to this conversation. So maybe to kick off, I'd like to invite each of you to just reflect on that one topic. What does climate and health mean for you? How are you looking at the climate health nexus in the context of your work? Meredith, let's start with you.
Sure. So as we think about climate change and its impacts at the Department of the Navy, and this is the Navy and the Marine Corps, 2 services that go into our Department of the Navy there, we think about how it is time to recognize that as a national security threat. And for us, climate readiness is mission readiness. We think about our work, it's alliterative, it's fun in 3 C's. So think about communities, critical infrastructure, and climate action. And the cornerstone of all of that work falls within the health perspective. And so as we think about what it means to have a ready force, it is a healthy force. We think about some of the places that we see conflict generating, and it is in health. Your Marine Corps in the United States is the Title X crisis response unit of our forces. And so as we see impacts for health, humanitarian assistance, and disaster relief, it is the Marines who are going out first. It is the Navy that is helping to respond. And so we look at this cornerstone not only as a place of impact, but a place of opportunity. This is how we generate critical partnerships, maintain our partnership of choice. We do research and ensure that we are contributing to the development of solutions in the health realm, paying close attention to vector-borne disease, the impacts of heat, and overall how we consider safety both in the environment that we are operating and also in our force as we are called to respond.
All right, really interesting. I'm excited to dive a little bit deeper on that in a minute. But Johanna.
Great, thank you. So I'm part of Takeda, and Takeda is a large biopharmaceutical manufacturing company, and we deliver life-saving treatments. And we're driven by our values. We have a long history. We're 240 years old, and our values really drive our corporate sustainability efforts. And at the heart of our corporate sustainability efforts is this nexus around climate and health, and how we're applying it is across our therapies, our operations, and our value chain. So when it comes to our therapies, we recognize that our disease areas and patient care is exacerbated by climate. So these are things that we have to think about, whether it's cancer, GI, rare diseases, how climate is impacting our overall patient health, but also thinking about healthcare resiliency and access to healthcare, especially when it's impacted by extreme weather events. So this is another area that we're focused on. And we're also thinking about how climate-related illnesses are now coming up, and it's a big part of where we're now starting to think of a focus. We do have a dengue vaccine. So dengue, for some of you may not know, over the world, almost half of the world's population is living in an area with risk to dengue. And about 40,000 people die every year from dengue. So this is an area of focus where dengue is being exacerbated by climate, so these vector-borne illnesses. So I think these are something that we're thinking about is how climate is interacting with the disease areas that we're focused on, but also helping to ensure continuity of patient care. This is critical as we think about a just transition for climate. When it comes to our operations, we're proud that we have SBTI validated targets for net zero. So we have 2035 scope 1 and scope 2 for net zero, and then 2040 across our value chain. And we're doing a lot of great things in terms of renewable energy, demand management. We have an exciting world's first heat pumps, high steam, high temperature heat pump for steam using 100% natural refrigerants. I was just there visiting our Vienna, Austria manufacturing facility. That's the first to pioneer this technology. We hope it's going to reduce our emissions by 80% at that facility. And we hope that that's something that we can share and scale, not just within our industry colleagues, but of course other sectors. And lastly is around our value chain. So thinking about what do we have to do to engage suppliers. The value chain emissions are really 90% of our overall footprint. So engaging our suppliers, encouraging new solutions in this area. And this is something that we're trying to focus on. What are those areas that we can tackle today? But what are those other hotspots in the future that we have to be ready for to drive emissions reductions on in the future and get ready for 2040?
That's great. You hit on a lot there, Johanna. I'm excited to continue our discussion, but Dr. Zhao.
So, Adam, thank you. You know, I have to give Adam tremendous credit for realizing such an important area and believing in it. We had many conversations with him, and the Climate Action Week, we launched the first inaugural Climate and Health Day. And here we are, a whole theme with somewhat 60-some meetings over this. And we just actually organized a countdown before this meeting where many of you participated, talk about, well, what are we going to learn about here? So you have characterized it as, oh, you changed it fast enough. I was a founder of something which I wasn't quite sure of.
You were doing Connie's job.
Ah, there you go. Yeah, okay, thanks. Okay, so maybe I should begin by saying who we are, what our organization is, because then you understand what we're trying to do. So National Academy of Medicine is the founding organization, that National Academy of Sciences, back in 1863, congressionally chartered. So we're independent, nonprofit, but we are chartered to advise the government during Civil War and now advise globally on many different issues. So we work closely with Congress, with U.S. agency, but we also work globally and publicly. So our mission statement says, better health for everyone, everywhere. So that explains why we're into this space. Because that's our vision. Our mission says equity and evidence-based approach. So that's why this area is so important to us, because as you think about all the areas of health, climate ranks really high, but as everybody said, not a lot of people know about this. So our question in terms of our capability is, we advise Congress, we advise administration, we write reports, but we also convene, and we can bring together, you name it. So one of our big effort in looking at this issue is to say, how do you use the power of national academies to really, really make an impact in this area of climate and health? So we began with about 3.5 years ago. See, John Pat's here. A number of us say, let's do something about this, and created, in fact, launched what we call a grand challenge. And Judy Roden, who was a previous President Rockefeller, chairs this. And of course, I don't know, some of my staff may be here, but anyway, the grand challenge would be to say, do something bold and different, right? Don't do it yourself. Do it with everybody that counts. So we create a public-private partnership. You think about academy, you can say, oh, these are scholars and stuff, but not true. We have actually AstraZeneca, many different private sector companies, along with Kaiser and Cleveland Clinic and others, along with educators in medical and nurse educators, along with policymakers. That includes the CMI head Liz Fowler, as well as John Perlin, who's the Joint Commission CEO, and Don Berwick. And we together say, collectively, we've got to do something about this. Step one would be, as a health sector itself, what are we doing about making sure everybody knows about this problem? So a huge communication issue that we're working on. How do we educate our workforce to be climate savvy so it can practice but also tell their patients? How do we ourselves look at our own sector and therefore move towards much less carbon emission? For those who are not aware of this, the health sector emits 8.5% of total carbon of the nation. It's huge. But industry and hospitals all together needs to change. How do you, in fact, provide more virtual care, prevention, and supply chain, you name it? So that's a big area that we're working on. But we're also asking the question, it's not really only health sector that should be responsible for health. It's everybody's responsibility. So when you think about who's emitting carbon, and have they thought about what it means to health, energy, transportation, agriculture, construction industry, you name it. Suddenly we say we need to get everybody together to understand how important this issue is. As someone says, it's not really measuring, climate change is not measuring degree centigrade or carbon emission, it's about lives lost and lives saved. So I think what we want to do is focus on that and implement actions in preparing the system to be more ready, preparing community, work with equity issues. You're going to hear a lot about marginalized population, and also moving other sectors together. Final point. There's huge gaps in mitigation adaptation. So Kaiser, I say John Wu, who's here, have asked us whether we would do a study with them to look at what are the research gaps and what are opportunities. We just finished this one. You'll be surprised how huge it is. There are 4 domains, which I won't go over, but you can imagine the domains of disease, prevention, capabilities, technology, tools, and community. So this is a big, so for me, it's about health, period. It's about everything that we can do to bring this issue to people's attention and to mobilize all of us, everyone in this room, to work together towards reducing carbon emission and improving health. So we have launched, in fact, an initiative last April at the same meeting, which we call Accelerating the Climate and Health Movement. And so we have actually opened the tent to say, anybody who wants to join us, please join, Because first you want to say, we know it's important, we want to do something about this, and over time we're going to try to measure things together, have the same net zero goals, and start measuring, acting all together. So that's very exciting. So far, Adam, we now have about 770 hospitals sign up.
Yeah, so this is really encouraging what we've heard from all of our panelists. I think what I'm taking from each of you is just a direction of travel, right? In this broader a recognition and understanding within your respective sectors. Can you each of you share an example? Victor, when we were speaking backstage in the green room, you mentioned an example in Santa Rosa. Could we start with you, and then can we hear from our other panelists as well?
So yesterday in the same room, the topic was about heat. And so it made me think about heat, and I guess many of us can identify with heat. If you think about this past summer, was the hottest summer on record. Although someone said, I think it was Rachel who said, it's going to be the coolest summer going forward. That's pretty scary, right? And so the heat is, I think, emblematic of the issue we talk about. Obviously, we want to talk about air pollution, many others, but let me talk about heat. So if you look at heat itself, it's the #1 killer of extreme weather events. We can see flood, wildfire, you name it, but heat is really quite amazing. And so the really issue in heat is, you know, whether you live working outside in the farm, workers, whether you're in Africa, or whether in the city, where the amazing heat islands, which in fact have temperature that is higher, than the average by about 10 degrees or more in Fahrenheit. In North Carolina, where I'm a Duke professor, we have a neighborhood called Haiti, which was, shall we say, redeveloped urbanization. And there, the temperature is easily 110 degrees in the summer. So it's big time. The story I want to talk about is actually the Santa Rosa fire, because we heard from a doctor who's working in the emergency room. And here he was during the fire treating patients coming to the emergency room. As he was in the midst of doing this, he got a call from his daughter. He says, "Dad, our house is on fire." And mother's running into the house to get the pets. And he had hardly enough time to make sure they're okay. He has to go back and take care of the patients at 130. I talk about this story because resilience is so important. And of course, our healthcare workforce is stretched. These are the kind of things that we have to be ready for, and these are the kind of things that we really have to be resilient in order to do this. So I think it's a really important story.
Thank you. Johanna, a similar example in how this shows up in your work or at Takeda.
Yeah, absolutely. And just to kind of build on Dr. Zhao's comment about healthcare resiliency, you know, some of the things that we do at Takeda is to support healthcare resiliency around the world, especially areas prone to climate-related weather events. So one of the areas that we partner with is with Mercy Corps, Seed Global Health, Pathfinder, to do just that. And with Mercy Corps, so they're an organization that serves the Caribbean, which has a very vulnerable population to climate. And we've reached about 3 million people in the community just to help reinforce the healthcare infrastructure and to make the systems more resilient. We're also partnering with Seed Global Health, really tackling the workforce issue. So how do we also train and make sure that we have healthcare workers available, but also so that they're educated on climate-related issues and illnesses like heat and how that's impacting patients. So that's just one area, and I'm proud to say as well, we just announced last week in terms of our grant program, we have a grant program now open just focused on climate and healthcare resiliency. Over the years, our CSR program has seen more and more of these applications emerge, and now we're just focused this year on our 2025 grant program because we see the dire need in populations all around the world.
Yeah. Meredith, an example from the Navy.
Sure, and I'm going to pick up on the heat theme here because we are so concerned about heat. It is kind of the sneak attack in terms of an operational environment and a community. And so I'm gonna tell a little story from a recent visit that I had. But I went out to Hawaii, and I was visiting with our Marines out there. And there is out there an experimental unit. They do a lot of work in the Philippines in jungle environments. It's very, very hot. And when I go visit folks, I like to make sure that I recognize people. And so one of the people that the command identified to recognize was their doctor. And so the doc, this is a Navy corpsman. And I asked the corpsman, I said, what are you proud of? You're being recognized by this whole command. And he said to me, got my first plug, ma'am. And I said, I was learning a new word. I said, I don't know what that is. And he said, silver bullet, ma'am. And I still was not following along. And he said, had a Marine fall out from heat, ma'am. So he took the Marine's temperature. It was a quick response, but he had to recognize that there was a heat event. And so I said, okay, I said, that is so important. It wasn't the right way to tell the story necessarily, but it was so important that he identified that, because what this meant was, and I have a medical professional who can describe this way better than I can, but he recognized that that Marine's body got to a certain temperature where it was going to overheat and not be able to recover. That is what we need our docs to be able to realize, because it's not just happening to one Marine. We had a heat casualty where about 20 some odd Marines fell out during a training for the same reason, too much heat in a summer training. And so as we're looking at what that means, it means that we need medical professionals who are going to identify that in the field. It means that we need to have each individual safeguarding themselves against what it means to suffer from hypothermia. Hyperthermia, and make sure that we are individual and aggregate safeguards against what it means to operate in an extreme temperature environment, because as I noted in my opening remarks, it doesn't matter what the temperature is, what the circumstance is, the Navy and the Marine Corps is going to go respond, and so we're putting that into our research development, our testing and evaluation of equipment. It is in our educational component so that people are aware. We are monitoring to make sure that people understand the impacts of heat, and this is how a healthy force is ready and functioning so that we can take care of the communities that are seeing the same impacts, but heat is critically important to be aware of, educated on, and guarding against, and so we need to advance our technology and our resources to remain a capable force.
Yeah, thank you. Did you want to comment on this, Victor?
No, if I may, want to make sure we talk about that climate change affects your health every single day, not just extreme events. You know, you don't even know, because we don't really measure it well, how the air pollution, air quality, you name it, is affecting your health. We do know that air pollution causes about 5 million, fossil fuel air pollution causes about 5 million deaths a year globally. We also know, of course, about cardiovascular disease. I'm a cardiologist, respiratory disease, asthma, mental health. We also know about vector-borne disease and many others, right? And globally, there's also drought, famine, you name it. Yeah. So it's really a big issue, and I don't want us to walk away thinking about wildfires and heat only, but in fact, even as you walk outside, I think it's affecting your health. It's hard to measure those things, but certainly McKinsey report are projecting another additional 14 million deaths by 2050 due to climate and health. I just want to kind of put that on the table as well.
Yeah, so with our remaining time, I'd like to pose a question to all of you. In the climate world, we often operate in scarcity mode because the resources oftentimes are not enough to implement all of the measures that are necessary expediently. And so that means we have to be more efficient about what we have, and we also need to find ways of deploying and attracting larger sources of funding to resource the work that all of you have spoken to. Can you share from your various perspectives and sectors, what has your approach been to resource mobilization? And if inadequate and insufficient, what is your appeal to our audience here? I think we have representation from philanthropy, from the public sector, from the private sector. Which of these groups needs to step up for us to be able to meet the needs of the issues that you've raised? I don't know if any of you are inspired to start, or would you like to, Meredith?
I'll start.
Great.
I'll say that education is a critical component that I just don't want to go by. Dr. So your leadership and Adam in convening this, your point is so well taken that it is in the everyday, and that is one of the most consequential pieces of the impact of climate change on health, is that we do not have a population, take your pick of the population, that is educated and aware enough to know what those starts of impacts look like. And so I think of safety impacts, the way that anything can operate in terms of decision making, and those little things start to have greater impacts. Mental health, I'm glad that you said it, incredibly impactful in terms of what's there. And so education and consistency of that information through various communities and channels is one piece that I would encourage. From the Department of the Navy specifically, we have a Center of Excellence that looks at vector-borne disease, and a warfighting center that tests the impacts of climate change on the way that the warfighter operates. And so those are some places that within our specific community we're taking the opportunity to advance, to focus, and also to educate. In terms of funding, this is an interoperability issue for us as well, and so we partner with our allies and find places that we can come together to assure that when we are operating together that we are doing so on an equal footing and in an informed way together. And so it is a piece that we work on with partner militaries as well. And exercise with allies recently in the Caribbean. I know you mentioned the Caribbean as well. It is a shared point of resilience. And so making sure that both resources and opportunities are there to include the Mercy class hospital ships that we have, both the Mercy and the Comfort, to offer opportunities to be a support to folks as we increasingly encounter these types of humanitarian events.
Yeah, so partnerships to achieve those efficiencies. Great.
Yeah, so building on what you were saying, speaking on partnerships, I do think collaboration is an area that we're focused on in terms of aligning and mobilizing resources. So, of course, the pharmaceutical industry is highly regulated. It's very difficult sometimes to get innovative breakthroughs through, especially when it comes to our therapies. And so that's why our industry is starting to band together to come up with key initiatives to help solve this problem in aggregate. For example, the Energize program, I see many of our colleagues involved in that program, but Energize is a way to drive access to renewable energy across, not just for our own companies, but across our suppliers as well. And so we have some exciting announcements about that this week. We also have the SMI Sustainable Markets Initiative, the healthcare working group, and they were focused on green heat, renewables, also looking at life cycle assessments for our therapies. So how can we better understand the impacts of our products, but be transparent in a credible way so that people can make more informed decisions? And lastly, what I'll say on this theme of collaboration is that Takeda, we're now focused on what we call hard-to-abate emissions in our value chain. So there are emissions that we all have net zero action plans, but there are emissions in our footprint right now that we do not have solutions for, or even scalable solutions to actually see a benefit or to see an impact for us to have or achieve our net zero targets by 2040. So we're now starting to catalyze some innovative partnerships, unlikely suspects, so bringing the waste vendors with the packaging engineers, with the plastics engineering, the chemical industry together with hospital systems and healthcare entities so that we can band together to find solutions to start mitigating these impacts. And we're starting to maybe work with an organization called Boston Medical Center. They're the largest safety net hospital in the Boston area, also a pioneer in sustainability, but we're starting to test and pilot some of these solutions so that hopefully we can scale and transcend and show how we can decarbonize the healthcare ecosystem. So the theme was around collaboration, and we hope to see more of that.
That's great. And also investing in these technologies of the future, which is, we obviously have technologies available today, but not all of them exist yet. Right. Victor.
Well, I'm really encouraged in this conversation, then see our friends and everybody in the audience who are all working together on this. Collaboration, partnership, mobilization, you name it. So, when we talk about the need to get this message out, the message we always give is say, alert, alert, alert. This is a crisis, right? And it's a negative message. I think there's also a very positive message here. Certainly from our collaborative, we've seen that. We have CEOs from supply chain, pharma, device, all sitting at the table, along with leadership in healthcare, along with educators and policymakers. That simply says that a lot of people care about this. And I think this whole idea of working collectively together is the only way, I believe, that can solve this problem. So when you ask funding, we're very lucky because of that kind of collective energy, we have received money from foundations, from industry, from government, and you name it. So to me, it was not so much an effort about how do you raise the money. It's actually how do you make the case so important that those who care are going to jump in and work on this. And certainly, it's been our experience for the last several years, been a phenomenal energy and momentum going forward.
Yeah, so to not frame it as a cost or as a sacrifice, but to actually talk about the opportunity inherent
Solutions.
in those and the availability of those solutions, right? So you bring it forward rather than it being something distant. I think we are out of time, unfortunately, but gratitude to our three panelists and to Adam for the leadership of the climate group and bringing this conversation together. Thank you very much.
Thank you.
I'm sure this conversation will continue. Stay here. Okay, we're now going to transition to a short fireside chat. Yeah, maybe right next to me. All right, I'll sit closer to you.
Yes.
Delighted to now be in dialogue with Pam Chang.
Thank you.
You are the EVP and Global Operations and IT and Chief Sustainability Officer at AstraZeneca. So just building on the conversation that we just had on this panel, could you share what the climate health nexus looks like for your company?
Absolutely. So first of all, thank you, Shyla. It's wonderful to be here today. I would say it is super encouraging to see more and more that connection between the climate crisis and human health, and the recognition that the climate crisis is really the largest public health crisis of our time. And I think we made the connection at COP28 last year, and it's a breakthrough. So with that, I'd like to address your question in two parts. One, if you think about the pharmaceutical or the life science and healthcare sector, we are in a business to heal. We are in a business to make people healthy. But at the same time, we are a significant contributor to the climate crisis. The healthcare sector emits about 5% of the total global emissions. Now you might say, it's only 5%, but that's more than the aviation sector. It's a lot, right? So what can we do? So I think, the first part of what we can do is really that fundamental decarbonization of our supply chain. Scope 1, 2, 3 that you all know very well. But decarbonization is not enough. We also need to take care of our nature. So if you look at medicine, for example, significant part of the raw ingredients and materials that we use in manufacturing of medicine comes from nature. So how do we make sure that we protect nature, to restore nature, to ensure that we do our part by minimizing the dependency on nature, using things less, right? Stop contributing to the nature issues like pollution, for example, and really play a part in restoring and regenerating. So I think that's the first part, decarbonization, nature, and biodiversity. The second part is really around the health systems. If you look at health systems around the world, many are under-resourced, overstretched. And climate-induced disease burdens, unfortunately, disproportionately impact those that are vulnerable, more vulnerable, in certain geographies like Africa, for example. So we need to kind of do a part to focus on prevention to make sure people don't get sick. And then when they do get sick, how do we detect their disease and provide early screening so that they can be on a guideline-based treatment as soon as they can, so that we keep them out of hospital settings. So by doing that, it's almost always certainly better patient outcome, and then it's better for the healthcare system, and it's better for the environment. So those are the two parts that I find that the healthcare sector really needs to play a part in.
And your CEO, Pascal Seurat, was on our inaugural Time 100 climate list last year. And what we found is that the entire industry and sector is actually woefully behind. So it was really remarkable to see AstraZeneca's leadership in this regard, largely in part due to the effort to align around industry standards. So can you speak a little bit about what are the efforts that are being made to create standardization across the industry and bring the entire sector to where AstraZeneca is?
It's a great question, Shaila. So I would say we are very fortunate within AstraZeneca where from our chairman to the board to the CEO to executive committee, which I'm part of, we build in sustainability into everything we do. We don't run it like a separate function or initiative. So you can see from my job, I have multiple day jobs. My job is running all manufacturing, supply chain, IT procurement for the company, but I'm also the CSO. So, and I run them together. It's just part of what I do. It's part of how we do R&D. It's part of how we conduct the business, for example. So in AstraZeneca, we have a very ambitious carbon program called Ambition Zero Carbon. So we pledge $1 billion to reduce our scope 1 and 2 emissions by 98%, absolute reduction, by 98% by 2026. So there's a little bit of a nervousness, but thank you so much.
Remarkable.
And it is quite remarkable, I have to tell you, when we declare the target, I'm sitting in my chair and saying, okay, it's not that long away, but I have to say that at the end of 2023, we are at 67% reduction. So we are on the trajectory of hitting 98% by end of 26. By 2030, we're going to absolutely halve the scope 3 emissions. So that's absolute reduction, not through offset, not through credits. And we would do that. We are starting to work with our suppliers on that. We also pledge $400 million in a program called AZ Forest. We aim to plant 200 million trees in 6 continents. Now, people would say, Pam, what's the big deal about planting trees? Well, it's really more than trees. When we work with the 6 communities in these 6 continents, we work with the local experts, the local communities, and really it's about the economy of the local communities, the livelihood, and really around the whole biodiversity ecosystem. So we are working on that. We hope to have all 200 million trees planted by 2027. So that's another huge ambitious target. When it comes to healthcare systems, unfortunately, you look at regions like Africa, for example. WHO estimated that the climate-induced sort of health burden will impose about $4 billion of cost per year by 2030. Mm. And guess what? 80% of which is shouldered by Africa. So how do we help? How do we help with healthcare system resilience in Africa, for example? So in 2014, actually 10 years ago, AstraZeneca had a program in Africa called Healthy Heart Africa, focusing on hypertension. And I'm delighted to say over the past 9+ years, we screened 57 million people on hypertension, high blood pressure, and 11 million of which had elevator ratings. So think about readings. So think about these 11 million folks who didn't know they had hypertension, and now they do, and they can be treated, and they can avoid more severe diseases, if you will. We train about 11,000 healthcare workers. So now, in response to the USA Prepare call to action, we are now expanding Healthy Heart Africa to focus on heart and kidney diseases. So really focus on 4 objectives. One is around education and awareness around heart and kidney diseases in 9 different countries in Africa. Training healthcare workers, provide early screening to make sure that we provide screening opportunities and detection opportunities for patients with potential heart and kidney failure diseases. And then lastly, to generate these evidence to kind of help make better policies within the region, if you will.
Yeah, that's remarkable. Congratulations on all of the
Thank you.
progress. A lot of what you described seems to be a public sector responsibility. How does AstraZeneca work with governments, and or in which cases do you step up and perform the role that typically the government would or should play in a community?
So first of all, I think there's ample amount of role both private and public sectors can play and should play. We are believers that the private sector have a profound responsibility to act, and to act now. And quite honestly, so I'm a very competitive individual. We play to win. However, when it comes to sustainability, it's not about being competitive. It's about motivating, inspiring, getting others to do the same, and learning from others in terms of what they are doing. Because if we all collectively act, we are much, much better off, right? So this notion of private and public partnership, we need it at bigger scale than ever before. We really do. Because I think the previous panel said it, not one individual, one company, or a single country can make a difference in this. It takes all of us to be able to move the needle. So for me, coming to events like this, talking about what we are doing within AstraZeneca, making that connection between health and climate, I think for me, we start with one simple motivation. It's getting that awareness out there, learning from others in terms of what you all are doing in this, and sharing what we are doing in the hope that we can learn from each other, and coming out of these things, we all do a little more. Because truth to the matter is, we only have one planet, and we are in the business of helping people become healthy. But if the planet is sick, what we do is moot. So it's paramount that we act.
Incredible. Well, in our remaining seconds here, any words of advice, guidance, or an appeal or hope for the road ahead?
Yes, for the private sector, so the companies and organizations out there, many folks would argue it's very expensive to be sustainable. And how do we come up with the money and funding to do it? I would argue it is good business to be sustainable. I think it's a matter of time. The regulators, the customers, the payers would demand the companies operate in a very sustainable way. And AstraZeneca, we've actually fundamentally decoupled business growth and our emission. We've doubled our revenue over the past 10 years, and we've halved our emission. Wow. So we've decoupled it, and hopefully it's proof that it can be done.
Yeah, well, I hope that your story serves as an inspiration to everybody listening, and look forward to all of your achievements moving forward, and the entire sector rising up.
Thank you, and thank you to you and Adam and the entire Time organization for what you guys do as well. Thank you.
Thank you.
Now going to introduce you to the second half of this panel, and we really want to look at this from a slightly different angle. The session title here is Climate and Health, New Narrative. And this is about how we engage with different audiences and how health can be a way in which we can get through to so many more people. And I'm delighted to hand over to Rebecca Jacobson. Welcome.
Thank you so much, Adam. It's been a real pleasure working with you for a while now on bringing this new health theme to Climate Week. It's very exciting. I'm here in my capacity representing a team putting together a new citizen art and science festival called Canopy. It's organized by the Wellcome Trust. It's both public-facing and stakeholder-facing, and it's about bringing health to climate action. And so we're very interested in narrative and storytelling, and I'm thrilled to be joined with these panelists, and Stephanie, Jeremy, Parneet. I want us to have as much time as possible to talk, so everyone look up their fantastic titles. And but just to set us up a little before I jump into questions for each of you. I really appreciated in the previous panel the setup where there were a lot of questions asked. I think it's similar with this question around storytelling. So we say we need more storytelling around climate. What do we mean by storytelling? Whose stories are being told? Who's listening to those stories? How are we telling those stories? How do we feel about those stories? There's nothing really, in my opinion, but maybe that's because I'm a story person, that's more important than this set of questions if we're going to actually address the crisis that we're in. And I'm just so thrilled that these three people bring really interesting perspectives that genuinely speak to one another. So I'm going to just ask one thing before we dive into the questions. I need you to do an active listening exercise for me. I want you to listen for keywords throughout this and jot them down. Try to remember them. To think about how we can collectively change our vocabulary for talking about climate, specifically through the lens of health. So let's jump in. Stephanie, I'm really excited to learn more about your new research coming out about climate and health narratives, and especially thinking about gloom and doom narratives and mainstream media narratives and what you've learned recently.
Well, thank you so much, Rebecca, and thank you all for being here. It's really great to be together. We just heard from Victor, we need to talk about solutions. We heard from Secretary Berger that education, that climate and health is in the everyday. Everybody needs to know that. So we researched this question. How much of the content? So I would love for you all to think for a second about all the content that's out there on the internet that deals with climate change. So TikTok, Instagram, Facebook, X, the major social media platforms, but also the headlines that you see. How much of that content, like in a percentage, do you think deals with health? Is it 50%? Is it 30%? 10? What do we have? About 3%. What else do we have? 1%. 1%. Anybody else? 0.5. Well, that will make some people very sad who are in the room and are working really hard on communicating about this. So it is 3.1%. So in 96.9% of the cases where we're talking about climate change, we're not mentioning health at all. And people sometimes ask me, well, why does it matter? Why is that important? What are the American people's number one priority? What is the number one priority of the American people? The economy. What is number two? Health. Where's climate change? 5, 6, 7, 8, 9, 10, depending on the survey or the study. It's not third, it's third is security. So when we connect climate change to health, all of a sudden, we have a whole nother set of people who might care. That's really important. It's also clear that by making it about health, we're able to connect it with experiences that we have. We just heard some great examples about the heat waves. And I'll talk a little bit about the solutions later, but I was thinking about the vulnerable populations term, right? So if we're thinking about terms to use, like who's a vulnerable population? Do you want to be vulnerable? I'm realizing I'm hardly hitting that age of, I'm going to be vulnerable soon to the heat impact, in my state. So let's think about how we talk about this, when we talk about it. But only 3.1% of all of this content out there is currently touching on health. That's by far not enough. In our work, we also then looked at, so within that data that we have, and we collected 2.4 million social media posts and headlines. Within that small data set that actually discusses health, how is it being discussed? What can we learn from that? How are we currently talking about the connections between climate change and health? Unfortunately, almost 60% of that content is doom and gloom without any actionable solution or any solution. So no wonder we see climate depression. It's just too much negativity all the time. It doesn't mean that we don't need to talk about the negative impact. That's really important. We don't want to wash over the reality of this. But as human beings, how much of that can you take before either you tune out or you become hopeless? So part of health, and health has always done this on a lot of different topics, part of talking about health is also about there's things we can do here, like it affects all of us, and that gives us a pathway into, like I can protect myself against the heat wave. So health is also a pathway to action. And I'm not just saying this because I'm sitting on a panel here. Research actually shows that people engage once we make climate change about health in different ways and are open to action. So that's also really important. And then my last point is about the biggest surprise to me, I'm a longtime journalist and storyteller, the biggest surprise to me in our research was we're not using storytelling almost at all. we're not talking about the personal impact. That's a huge missed opportunity. So this research that we're launching today, together with Adam and his team, really helps us understand all these missed opportunities in our current climate conversations and how we can do better on that. Thank you.
Thank you so much, Stephanie. And I think it's a great segue into Jeremy because Stephanie alluded to, described how there's this real doom and gloom approach and also just a media ecosystem that's quite broad and scattered and around social media. And I really appreciate, Jeremy, what you've been doing with Black Iris Project and specifically Blood in the Soil as a different approach to storytelling and a really rich example of what could be. So please share.
Of course, thank you. My name is Jeremy McQueen. I'm going to tell a little bit of story myself. I am originally from San Diego, California, and I first fell in love with the arts and theater when I became about 8 years old. My mom took me to see the national tour of the Phantom of the Opera, which I always tell my students now is the Hamilton of my generation. And we sat on the last row of the balcony of this huge 3,000-seat theater, so high up that we could rent binoculars. And we rented those binoculars. I practically hogged them the entire performance as I sat on the edge of my seat, completely entranced in the story that was unfolding before my eyes on stage. That first experience that I had to experience live theater and dance forever changed my life and the trajectory of my career. I looked at my mom after that performance and said, I want to do something like this. I didn't know that I could make a living as an artist. It didn't really matter. I just loved the energized, safe, comforting feeling that it gave me just to be in the space. I didn't care if I was going to be a musician, a stagehand, pushing a set piece around backstage. It was an addictive drug in a sense that I just knew I wanted more of that experience. Fast forward to many, many years of hard work. I've been in New York City for the past 20 years now, working both as a Broadway performer, having seen some of my wildest dreams come true, performing in Broadway's Wicked, The Color Purple, to name a number of others. But one of the biggest things that really frustrated me as a queer Black kid, especially growing up in Southeast San Diego, was the lack of diversity that I saw within the dance forms that I was taught, specifically ballet. Having done so many different classical ballets as a young child and as an adult throughout my professional career, I felt like there was a lot of stories that were being missing from being told. Often what we know of classical ballet are stories of fairy tales and fantasies or stories that are rooted in European fables and tradition. And so with my collective that I started in 2016, the Black Iris Project, what we do specifically is we center Black narratives through a classical ballet lens, bringing together Black artists from all different artistic genres to be able to create new narratives that amplify the voices of the communities that we want to affect, but also to give them an opportunity to see themselves and their lives and their stories told on stage in a fashion that's commonly not told around the United States. And over the past 3 years, I've been working on a new ballet entitled Blood in the Soil. And essentially what it is it's an ode to Black farmers, Black agriculturalists, Black gardeners, and stewards of land who have really poured into this world and have not always received a lot of recognition, credit, or opportunities to share their experiences. So over the past 3 years, I've been interviewing Black and Indigenous farmers from all across the country to document their stories and transform them into an artistic work of art that encapsulates the various challenges that they've had, not only with the climate, but also being able to use the work that I do as an education tool to explain to especially young kids from communities like where I'm from about how their past impacts their present and their future, and why it's important to have a connection to soil and to have an understanding of where our food and how everything is connected in order for our growth.
Thank you so much. Do you want to share? I'll come, hopefully we can talk more because I want to hear more. I was thinking about Jeremy's example of how storytelling, again, is not just words. It's through dance. It's through music. We feel it. It resonates with us in our bodies. Long-form interviews that go in-depth with Black and Indigenous communities. It's very, very different than some ways stories can be told about climate and health, so it's so great. And I do want to move to Parniti and make sure you have time to share. So we were talking about the scale of social media and the news cycle, and then we spoke about the scale of the individual and the body, and now I want to hear a little about the cellular and subcellular level and stories in a very different way from you. Thank you with your medical experience.
Thank you, Rebecca. So as a physician and as an educator, I have yet to come across a single person who does not want to be healthy or who does not want their children or their families or friends to be healthy. So I think health, first of all, is an amazing equalizer. It cuts across race and gender and political leaning. And the stories that we tell ourselves become how we see the world. And I think it's really important to keep that in mind, because if we are to make complex systems change, the strongest levers that we have are shifting mindset and paradigms and narratives. So with that in mind, I want to share a couple of alternative narratives from a cellular standpoint that we could be talking about. The first one is that health can become our most powerful ally to get us out of our addiction to short-termism. In the climate community, I think we're hearing this over and over again, that we have access to all the technology and resources that we need, but we still are not moving at the speed and scale required to meet our sustainability targets. And of course, there are many reasons for that, but some recent research shows that cellular inflammation affects our moment-to-moment decision-making. And even low levels of cellular inflammation affect our moment-to-moment decision-making. And this is because biologically, inflammation is perceived by the body as a threat to its survival. So it makes us want to grab onto whatever resources we have in front of us. It makes us more impulsive. It's harder for us to delay gratification. And it puts us into that mindset of short-termism. But in healthcare, we have a lot of body of evidence on how to reduce inflammation, because inflammation is also the starting point for most chronic lifestyle-related diseases that account for the majority of our healthcare spend. So we have the data, we have the science, we know how to get the inflammation levels down through our lifestyle. And when we start to do that, we can then help everyone sort of also move out of this mindset of short-termism. And then the second story, and perhaps the more exciting story that I'm very passionate about, is to shift the narrative of our bodies and our health towards the awe-inspiring wonderland that resides in our bodies. So if I may, and I would love for all of us to just do a collective thought experiment, just a quick reflection right now. Are you game? Good. So what I'm going to ask you to do is, one, to just tune into your body for just a second. Just take a breath, tune into your body. Can you become aware of it? And now I also want you to bring to mind somebody that you love, that you really care about, okay? And just know that there are 30 trillion cells alive and pulsating in all of our bodies in this minute. And they're alive and pulsating because there's literally an electrical charge that's moving across cell membranes. You are literally electric. And the source of this electricity is your cellular metabolism. And metabolism is it's the language of life. It's the 1 billion chemical reactions happening every second in your body right now that break down food to release energy, to remove waste from your body, and to help your body grow. So you're electric, you're also metabolic. And the beating heart of your metabolism are your mitochondria. And these are ancient bacteria that were co-opted by multicellular life more than 1.5 billion years ago because they had this unique capacity to use oxygen to break down food and release energy from it. You have 14 quadrillion mitochondria, and they are literally fueling the miracle of your everyday life experience. So everything from you waking up this morning to maybe the hug that you gave a loved one to maybe the brilliant idea that you're going to have to save the day at the office. And in addition to fueling this miracle of your everyday life experience, your mitochondria also make you regenerative. So your mitochondria are literally running the most efficient circular economies in your cells. So they take old damaged DNA and cell parts and convert them into new sources of energy. And when old cells die, they're immediately replaced by new ones. So just in this past second, 10,000 of your lymphocytes were just replaced. They're a type of white blood cell. And your gut lining renews itself every 2 to 3 days. So I give these examples just to share and hopefully start you to start thinking of your body not as this isolated casing of flesh and bone, but think of your body as this multi-species ecosystem, because right now what's happening is that your mitochondria are listening. They're listening to the rhythm of your life, how you eat, how you move, how you sleep, how you manage your stress, the quality of the air that you breathe, the water that you drink, the quality of the food on your plate and the soil that that food was grown in, the number of social interactions that you have, the pollutants that you are exposed to. And essentially what your mitochondria are doing are they act as these transducers and this interface between the outer and inner ecology. So they're taking all this information in, and their only goal in life is to keep you alive and well. And they take that information and transmit it to the nucleus, and then you have all kinds of gene expression and changes in cellular metabolism that keep you healthy and well. And your mitochondria also collaborate with your microbiome, which is the trillions of bacteria, viruses, and fungi that live on and inside your body and inside your gut. And so again, just when we talk about the language of health and the narrative that we need to be sharing, I would love for us to shift our thinking of health as something that happens in the doctor's office, and instead start to think about health as the emergent property of the systems that we're surrounded with. And as you start to understand what keeps us healthy, because if you understand this relationship between inner and outer, how would you treat the air? How would you treat the soil? How would you treat the forest? How would you, what kind of food would you put on your plate if you understood this relationship between inner and outer?
Thank you so much for that, Praneet. Yeah, wow, I love it. It's a moving panel. I'm really grateful to be up here with you all. So we were talking in our preparations for this panel about how having a lot of talk and telling a lot of stories is only useful if those stories lead to action. And so we wanted to make sure everyone on this panel could have a chance to share their call to action. So let's go in the same order. Stephanie, can you share your call to action?
My call to action. I'm still in touch with my mitochondria right now. Find the stories. There's so many amazing stories out there right now, like one we just heard that none of us been thinking about before entering this room today. So we need to do a way better job connecting climate change to health, and we need to do that by telling stories, but also reach out to a young person in your life today. The generation that is hurting the most, arguably, from how we have been communicating about climate change are our teenagers and our young adults. And they need for us to be there as partners, and also for us to be open to those solutions and to the actions and everything that we can be doing.
That was beautiful. To further that along, I would say invest in artists and collaborate with them. Art is such a dynamic way to tell stories aside from just looking at data and facts, but also making sure that you're telling those stories authentically, centering not just those that you can get to, but also those that might be most impacted economically by climate change and climate injustice. So today I would say, in addition to going to and connecting with the youth, find a way to engage with them in conversation about where their food came from, even if it's going to a grocery store and asking a grocer, where did this food come from? All of that information and education helps us create a better future for ourselves.
My call to action would simply be to get curious about your body and your health. So if you're inspired, go read up about mitochondria, go read up about the microbiome, and start to understand that relationship, because when we actually notice those relationships, it's really hard to be confronted with just the complexity and the awe and the beauty of our body, which is part of nature. It's not separate from it. And that can help us to sort of take a breath and move away from some of that fear and anxiety, and move into more of a state of love and appreciation of what we hold, and what our families and those we love hold. And when you love something or someone, you don't need motivation to take care of it. Love gives you the courage to, put in the hard work, go the extra mile. And so, yeah, just using using our biology to help us move into the state of love and appreciation.
Thank you all so much. I guess I'll add, mine would be echoing a little what Jeremy was saying. For those of you in the audience who work in philanthropy, who work in the business sector, who work in policy, reach out to your creative networks, reach out to your cultural friends and networks and family, because we all know people, right? Talk to someone you know about your work and how to reach more people. And when we say we want to do cross-sector work, what I would really love is to have the strongest collaborations possible that include creatives and cultural leaders, because that's really what we need, given what the narratives are coming from the fossil fuel industry, right? So we know what we're up against, and we have to all really work together in that way. So thank you. I couldn't resist answering the question, even though I'm a moderator. So just as we have a little more time, and going back to the keywords, some people say, well, climate and health, that's kind of awkward, or I don't really understand, when we're just having informal conversations. And I'd love to hear, what are the challenges and opportunities? We've talked already a bit about the real opportunities with climate and health, but it isn't obvious to to everyone that you're just casually talking to. So how can we move forward, really reaching back to other keywords that maybe we didn't realize were relevant to this conversation, and going forward and creating new keywords? If we have time for each of you to jump in on that. And it could be out of order if someone feels inspired.
I'm German, so I'll stick with the order. I struggle with the keywords question completely, because that's not how I perceive or walk in the world. Like, keywords are different for different people and communities. And how are we to say what the keywords are? That just feels like a very heavy approach, when what we want to do, again, is to go into community to understand these impacts, and again, on our health, but then also our communities and how we're connected. And I know this is all sounds a little, broad, and our recommendations say specifically, be specific when you talk about climate and health. But that's my initial reaction to the keyword question. We should get out of our heads, get into our communities to talk about what's happening, and then we bring those stories back and we share them. That's what's, in my view, is going to help.
There's so many young kids in New York City who have never been to a farm, have never felt a connection to soil or the earth. And I think that we need to find pathways to be able to do that, to be able to get them out of this concrete jungle, to be able to take them to open air, to take them to farms and let them see what it takes to bring some of their grocery items to life in real time, giving them opportunities to experience what a connection to soil can do for the physical body, for the mental body, for all of those things holistically.
Well, I have lots of words. One is microbial diversity. So picking up on what you were saying, and I just love this, the title of your work, Blood and Soil. I mean, that's so pertinent and so poignant, I think, in this conversation. But microbial diversity, we need microbial diversity in the soil so that there's microbial diversity in the food on our plate, and that will inform the microbial diversity of our microbiome, which will then keep us healthy for our digestion, for our immune system, for our regeneration, for our mental health. Another word I think that we need to really pay attention to is depressed. You know, we are so attuned to living these crazy, frenzied lives that where we over-index on growth and productivity. And this is what burns us out. This is what causes the inflammation. This is what gets us stuck in this repeating old cycles of behavior. And so taking deep rest, which could be in many different forms, you know, meditation for somebody, taking a walk in nature, sleep, just getting an extra 15 minutes of sleep every day. And then the third keyword is hormesis. Hormesis is short adaptive stress that actually turns on the longevity genes in our cells. And so that could be, you know, a really fun way would be dance and movement and exercise is, you know, one way to turn on those systems. So lots of words.
Thank you also for beautifully connecting all these different strands. That was really awesome. So I wanted to add just a concrete example for why I say I'm struggling with the words. And that is, so we did this information ecosystem analysis, right? Out of all the climate content that's out there, how are people talking about it? But you need keywords to look for that. And that means we're assuming that I know how people are talking about it, or that our team knows that, which is what's wrong with the science to begin with, right, when we talk about science and communities. And we need a bidirectional way or a multi-directional way to do that. So part of what we're thinking about is like, when you look at, again, climate change and health conversations online, we're not capturing how people are talking about, I can't pay for my electricity bill. But they can't pay for their electricity bill because the AC is running more often. And running the AC is part of your health. And it is going in and understanding the impact in the way that it is happening in people's lives and bringing those words back is what matters.
Thank you so much. That's such a great point. And just thinking about how much there's a need to maybe translate terms that are coming from policy spaces or medical spaces to recognize really the information that's coming directly from people and not miss and not have a gap. So it's incredibly important. So I'm so grateful to you. As we conclude, I'd love to hear if any audience members want to share any keywords that they thought of. Yeah.
And the end of fossil fuels is a new beginning for health.
Thank you. Anyone else? Just words came up for you. One came, oh, go. Sorry? Narratives. Thank you so much.
Collaboration, but also connectedness.
Collaboration and connectedness. I love it.
I was on the connecting the inside to the outside.
Inside and outside. Yeah?
Climate storytelling through dance.
Climate storytelling through dance. I love this. Well, thank you all so, so much for being here. Thank you. And thank you, Adam, for having us. It's been really wonderful.
Yeah. Thank you all.
Thank you,
Thank
Danielle. I really
you.
appreciate it. And just as we close out this, and thank you to both of the panels, it's been really fantastic. I think that last point is really, really critical because we're saying, we're using the language, this is climate and health. These are climate and health sessions. I'm having climate and health meetings. But I completely understand, like, those words together aren't working. Nobody understands it. And I think we've managed to successfully do this in so many other places. I think environmental justice is a great example. Everyone knows what you mean. Well, hopefully in this space anyway, people will know what you mean. And I think a lot of people have been asking, as part of this new theme, you know, how do you define climate and health? And I'm saying we're really using this week as a bit of a listening exercise as well, and it's going out across the rest of the week and going to different events, and that's going to help us define what it means. But I think, you know, we really need all of your help, and everyone on the panel as well, and through our very, very diverse backgrounds that we're going through, and understanding how do we define this issue so that in future years we're bringing through an even wider audience as well. So I'm going to close out with that and just say thank you very much for attending this event, and see you at the next one.